Today we're going to have a look at ISCs because obviously a lot of people use them, but not everybody's aware of techniques and procedures and why they have to use them. Intermittent self-catheterisation, for those of you that have never heard of it, is literally when a male or a female needs to go to the toilet to have a wee, but basically there's a problem whereby the urine's not coming out of the body. And this might happen intermittently, or it might be something that happens over a 24-hour period. So whereby, because it's dangerous and risk of infection, we need to insert a little tube ourselves. So obviously with the female anatomy, it's a lot smaller. The males tend to be a bit longer because it's got a lot further to go. Now, whether it's male or female, this is a procedure that's clinically at risk of putting you into an infection, so you have to be taught how to do it properly. And this would be your district nurse, your clinical nurses, or maybe one of the nurses from Vyne, which is what I do every day. If we look at the usage of these catheters, it completely depends on the individual person that requires to use them, because bladders are so complicated, everybody's different. So if we had, say, 10 patients, every single one of you would have a different reason why you need to use it, and the outcome and the amount that you take out your body. So some might use typically 4 in a day, some might use 4 to 6, some might use it once every other day. Everybody's completely different. But again, this comes down to you as the individual and the problems that you have. When we're using the catheters, we don't normally ask you to monitor the output, but maybe in the first few days, we might be more looking at what is happening when you use it, i.e. pain, bleeding, discomfort. But a lot of this is actually taught the day that you learn to use them, because all of this is relevant clinically, because we don't want you getting infections. So we teach you how to do a clean procedure, and then maybe a few days later we'll ring you at home to see how you're managing. If we look at the reasons for using an intermittent catheter, this is something that's taught to all individuals that have dexterity, are able to see their anatomy for a start, because that can be one of the problems. But there's not really a reason why you can't use it. It's, have you been taught to use it properly and safely? Are you following that procedure to cut down on infection risk? If we're using ISC, there's got to be a routine, there's got to be a procedure to follow. You're not clinical, you're not nurses, but if you don't adapt some kind of routine and follow this safely, one, are you going to be on top of you're actually emptying your bladder correctly? Is this going to lead to infection if you don't? But the professional that teaches you to do ISC should kind of give you an idea that you need to have a pattern to follow, you need routine, you need to follow a procedure. But it is quite easy to do, it's just that initial understanding of the risk. If you, I wouldn't say forgot to do it, but if you chose not to do it, all of those complications you had initially are going to come back very quickly, to the point where you might feel extremely ill. So obviously, you know as the individual, this is something you've got to do if you need to have full control on your bladder. If you're the individual that's able to void throughout the day, this might just be a check to make sure that we have completed, maybe in the morning, maybe before bed. But if you're the individual that chooses, do you know what, I know I should be doing it, but I can't be bothered, then you are going to end up back in A&E because you're going to be poorly. So it's very rarely that we find individuals who choose not to do it. There's normally a reason, but because we give them that follow-on phone support, we already pick up on these problems and we address them. So with blood, when we do the procedure, this is more than likely, I know this sounds a bit unfair, but with the guys, the male individuals, this can be quite common because the prostate in the male might be the reason for the retention. So we always advise before we even do the procedure that there might be blood, there might be a little bit of pain, but it's explaining what's an acceptable amount and what's the dangerous amount. And then we take up, if there is blood, don't panic, it's fine. If there's this much more blood, then there's a problem, you get to A&E. So we kind of As well as teaching them and they're nervous because it's a new procedure, we have to identify all the risks associated. So we have like a safety netting program whereby I would say there was a little bit of blood, it's fine, but if it gets any worse, you go to A&E or you stop immediately. With the females, maybe using an intermittent because of strictures or previous surgery, might have been, you know, fibroids, could be some other reason why the female's using one, but very rarely do I find they have the problems like the males might with bleeding because they have much less distance to cover. But yeah, we always give them safety advice. Relationships are difficult when people have problems with a bladder because obviously with a male it's also the sex organ. With a female we've got to think about the infection risk because cleansing is uppermost important before the procedure, but if there's relationships to consider, obviously we still want you to think about this as a procedure whereby you can have a relationship, no problem, but it's just the cleansing period before inserting the catheter, say maybe the night time or the morning after that experience. So relationships are fine, intercourse is fine, it's just thinking about the hygiene before and after.